Namaskar. We have the pleasure of having with us former Minister of Health, Government of Kerala, K K Shailaja Teacher. Thank you for being with us in this conversation.
Thank you.
Kerala has had many accolades as regards its performance in fighting COVID, and you have been the leader of that fight. Kerala has definitely achieved these goals with an entire team that you have been able to stitch together. I welcome you to this program today. The Central European University has awarded you the Open Societies Prize 2021. The United Nations has invited you to be at their Public Services Day 2020. How important is the public health system in terms of fighting pandemics like corona?
Yes, actually the pandemic became a litmus test to the governance system throughout the world. Then only the vast majority of people started to think about the health system, whether public system is good or private system is good, etc. And it proved that wherever public investment is more in health sector, there the mortality is very low, and also they can manage the crisis due to the pandemic. But wherever it is privatized and the poor people have no access to the healthcare system, they suffered very much. I think you notice what happened in America and UK and all the Western rich countries. They are not pro people, we can say so, for organizing this kind of healthcare or education, etc. And the capitalist mode of this governance are there, and the division is there, poor and rich. The divide is very great, and or it is more there. And there, when this pandemic occurred, what happened actually? Thousands of people died without getting proper medicine, without getting care, or without getting proper oxygen. Nothing they got. And the first phase of the pandemic, thousands and crores of people died due to that. But in certain countries like Cuba, Vietnam, and wherever the rulers planned for and prepared for the pandemic, there the people's lives saved. In Cuba and Vietnam we witnessed that. And in India, in our small state Kerala, we have some left ideology, and we are left minded. Our government is like that, and we are planning for people, and because of that we managed it. The Nipah and COVID and all the communicable diseases, when it started in Kerala, we prepared earlier before it come. Nipah already it come, and after that we planned very well way. And also when we heard about this pandemic, this new disease, communicable disease, the contagion, we started planning in our state for the people. It doesn't come to Kerala at that time, you know. When I heard about there is a potential virus in Wuhan, China, it is spreading there with high mortality rate and high infectivity rate, and I suspect it will come to Kerala. When I happened to read in one of the newspaper that the WHO's warning that a highly potential virus is spreading in Wuhan, China, I at once called my health secretary at that. I was minister at that time, and I called him and discussed with him. I said, Rajan, this virus will definitely come to Kerala, because I have some memories about the medical students who came to me before that for internship and for registration, who were studying in Wuhan University, China, and they came to me last time, and there are so many Malayali students there, and if the condition become bad, they will return to our state. and may be carriers. They may be carriers. So we have to start earlier. And that Nipah incidents also give us some experience that early detection and early preparation save a number of lives. And that way we prepared. We at once, my health secretary said, definitely madam, the vacation is starting there in Wuhan. He inquired about that, and we have to prepare. At once we formed our control room in Director of Health Service office. It was in January. It was in January 24th and 25th at that time. The virus actually come to Kerala 30th, January 30th. But we started every preparation. We formed as an expert group for everything, for collecting medicine and also for training, how to wear the personal protection equipments and how to prepare the health community for tracing and quarantining and isolating. Everything was planned. And because of that, we got the virus from the first day itself, January 27th, a flight from Wuhan came there via Saudi or like that. And some students returned to Kerala. But our team was ready there, for screening. The trained health staff were there in the airport. At time the universal screening was not started, and we are not able to get the information inside the airport because it is under central government and there are some customs for that. But outside the airport, our team stand there, and we announced everyone who are coming from outside, please come to our counter and to inform where you are coming from, and we have to test whether you have any symptoms. It is for protecting you, nothing else. We will protect you. And some of the students reached there. We found some symptoms in there, and at once we isolated them. Out of them, 3 were positive. January 30th, the first result come. The student who admitted in one of the district medical college, she was general hospital there in Thrissur. She was tested positive for COVID. And February 2nd another, and February 3rd another. We got 3 cases. But at that time, they were under our control, our custody, and in the isolation rooms in the hospital. And no transmission occurred from there. No one, their family members or none of them got COVID from there. That was the first success. That was the first phase. Then we continued that thing. At that time, COVID spread to Italy, UK, USA, everywhere. And expatriates are there in every country. Malayalis are there. Then they started coming back. And we strengthened our screening system, not only in the airport, but in the seaport and also by road, everywhere. There are trained staff for screening. And the first part, when the virus started spreading, the WHO said that test, nothing else. We have to test more to get the carriers of the virus. But in our state, we discussed it together. We adopted a little bit. It is par with the WHO's statement, but we little bit different from that also. We raised a slogan that trace. That is the first thing. Trace, quarantine, test, isolate and treat. We decided only the symptomatic should be tested at that time, because there was scarcity for the testing kits, etc. If we finished all the test kits we got, we cannot test properly the symptomatic cases. At that time it will go out and spread to the society, and we quarantined them, all the people who came from outside, and we started quarantining them and watching them during this incubation period. At first we adopted incubation period as 28 days. Some people were annoyed with that because 14 days is the actual incubation period. But during the Nipah incident, Nipah virus case, we found that even if it is 14 days, it may happen. Sometimes it go to 16 or 17 or 18 days. And we took the more preparation, more security for that, and that is why we quarantined the people for 28 days. Quarantining means not abandoning them. We prepared everything. Our government, under the leadership of Chief Minister Pinarayi Vijayan, he started to unite all these departments, and while they were in quarantine, our volunteers will go their house and ask what is your necessities. If you want food or medicine or anything, be frank to say, the government will supply it to you, and people feel comfortable there. Every day, morning and evening, they are going. Our volunteers, the ASHA workers, the junior PHNs, and the Anganwadi workers, and the volunteers, self-volunteers, are going to the home, each home, and to inquire about their safety and that things, and providing foods in their residence. And that is why people are willing to obey these things. And we adopt the containment method. At first, we prepared our protocol and standard operating procedure. I think it was we who started the protocol first in India, because the virus come first in India, and we prepared a protocol for the treatment and for this isolation, and to give medicine, which medicines we can give, what is the symptoms, etc. We started our protocol and coronavirus guidelines. It is known like that, and also our standard operating procedures also. And with that, we started scientifically just from the beginning. That was the great achievement. And other states asked us, what is your protocol? Please convey it to us, and we shared that thing to central government and also to others. The mantra is nothing but early preparedness and the punctuality and the right decision at right time, and this kind of tracing, quarantining, testing, isolating and treating. Always our slogan was to put the virus, or to keep the virus potential under the health system capacity threshold. Never we allowed, up to these days, never we allowed to come the virus up to the health system capacity threshold, because we were increasing the capacity of health system, always increasing the beds, increasing the ICUs, increasing the oxygen capacity, everything we were increasing continuously during this period. So we put the virus always under the health system capacity threshold. That is the thing.
That's wonderful, and that is one of the reasons why this entire exercise, and you as the leader, has been accoladed by the Guardian as the Corona Slayer. That's a wonderful conversation that's going around Europe. The requirement for actually expanding the threshold of the health capacity requires a great degree of political will and also financial support. As being a minister in the government, how did this evolve in the administrative and the political hierarchy in Kerala to actually take upon themselves to fulfill the human resource requirement for such a big exercise and also the financial requirement?
That is not a single person's activity, you know. I was not alone, or it is a government's policy. Our government is a left government, and we have pro-people policy to act such situation, to this kind of challenge when happened. We started our work unitedly, and the collective activity. Chief Minister called the entire departments together, and we formed a center there, a war center there, and every department acted well. And also our Chief Minister declared this as health emergency before the central government declaring the lockdown. And also 20,000 crores package was announced for this to contain this virus, or to give people assistance during this period. And we started a portal called COVID Brigade, and in that thousands of youths registered in that brigade to function as a voluntary work. They registered in that portal, and we opened community kitchens to give proper food for the poor family who were under lockdown. They cannot go outside and purchase foods, and we provide cooked foods through this community kitchen. Thousands of volunteers worked there. Even the Kudumbashree unit, our self-help unit, it is famous throughout the world, and that units, the women worked in the community kitchen, and they packed the foods to the home, and we distributed lakhs of packed food kit to each and every home. Other than that, we supplied food kits with rice and pulses, etc., to each and every family without the discrimination of rich or poor. Some rich people got this kit and they asked, why you are supplying this kit to us? We have money. Yes, you have money, but there is no facility to buy the things outside because of the lockdown. That is why we are supplying this thing. If you don't want, you just give it to the poor people. They did like that. Someone used that because they have no facility to go outside. And that was our plan. That plan, I think, succeeded in a good manner, and we were able to contain these things there. No one can become a coronavirus slayer or any virus slayer, you know. Viruses are tiny things, and we cannot predict when and where it appears and what changes it make inside our human body, how it attacks. Some viruses are good for health, some are very dangerous. This is a dangerous virus. But the Guardian called me, Laura Spinney, the famous writer, called me directly, seeing this news that the spread of the virus in Kerala is too less. Kerala have some vulnerabilities. Kerala have very good health indices one part, but some vulnerabilities in the other part. The good indices are our mortality rates are very low. Child mortality rate and maternal mortality rate is too low comparing to, we can even compare it to the highly developed countries, you know. And the human development index also, Kerala is very high. But we have some drawbacks, especially in front of the highly contagious things, because our population density is too high. It is 860 out of 1 square kilometer. National is, I think, 430. And the old age population is 14.5 in Kerala, above 60 population. It is a large number. And another thing, the lifestyle diseases are rampant in Kerala. And we are the capital of diabetes, Kerala. It is said like that. And these three things are entirely dangerous for to contain or the war against this kind of virus or infectious disease. So we have to be more conscious to prevent this thing to going inside. At that time, someone said, not someone in assembly, the opposition asked me, why are you containing these things? Why are you not accepting the mitigation method? Look at the USA, look at Sweden, etc. They are adopting this mitigation method. Let the virus to go into the society, and after that we all will get herd immunity. But I am a science teacher, and my government is left-oriented. We cannot think so. Because of these vulnerabilities, if we allow the virus to spread throughout the society, the above 60 should succumb to death because there are comorbidities according to the lifestyle disease. And also due to the thick population, so many people will die if we allow the virus before the vaccination, or at that time the vaccine was not invented, and there was no proper medicine, etc. There was scarcity for everything, even for the ribavirin and this kind of medicine we used for the symptoms. That also is not getting properly in market, and there was scarcity for that also. At that time, if we think so, to let the virus go out, and it become a very great challenge, a miracle to us. but we didn't allow. We said we are using the containment method. We have to stop the spread of virus. And we did that, and we adopted the strategy. I first said that to keep it under the health system capacity threshold, and also the break the chain of transmission. We started a campaign called Break the Chain, using mask, wearing mask, and using sanitizer or soap, and washing hands occasionally and properly, and also to keep social distance. And I think that clicked in that society, every person. The education rate, the literacy rate in Kerala also helped us. Every people can understand what we are saying. The precautions they followed, most of them, more than 80%, followed our precautions and the break the chain activity. And that is why we can cut the spread of the virus in the society. And also we declared the reverse quarantine for the above 60 peoples. We asked them, don't get outside the house. We will supply everything to you, your medicine for the lifestyle diseases, for diabetic and hypertension. We will properly supply the medicine to you in your doorstep. Don't get outside. Please sit inside the house until the virus is contained. We requested them. But each and every morning and night, our volunteers and our counselors called them by phone to check whether they are fine or like that. This is not an easy job. This is a hazardous work. We have to train thousands of counselors, especially for this. In our control room, we set several tables, and youngsters sit there from morning to night, 24 hours. Changing the people occasionally, and they were sit there to make telephone calls to the cases where cases reported, to the home, to the patient, and to the hospitals, etc. We were doing. It is a difficult work, but we arranged this. I'm lucky that I have a very good team. We created a team actually, saying the medical community, people are saying like that they will not unite always like that, but they are very good people. They are very brilliant people, doctors, nurses, and others, but we can unite them together like a machine with several parts. Then we worked from bottom to top. Each and every day I have meeting with my health team, one or other district or one or other COVID centers. We were analyzing and evaluating everything. And Chief Minister have the coordination meeting each and every day, or within 1 or 2 days he was conducting meeting and evaluating everything, where we were reporting about the health things and the public distribution system. They were reporting about the public distribution, etc. And we concentrated on this work. At that time, the central government also conducted a zero surveillance study. In that zero surveillance study, we found that the spread of the COVID is very less in Kerala. I think at that time only 11% of the population was infected. All the other state it is 50% and more, like to near 70 or 80% in some places. And in Kerala nowhere it was like that. It is below 11%, 10 point something. And seeing this result and the mortality rate, it is 0.4. It never reached 1% mortality rate. And seeing these things, the BBC called me, what is happening there, how you are doing these things. And also the Guardian, this famous writer Laura Spinney, she wrote a book about this 1918 flu. That is Spanish flu, a very good book. And several other novels and books she wrote. She called me directly and she wants an interview with me. And as you questioned, she questioned me, what is your method, what are you doing there, and how is it possible to contain this highly infectious virus. And I answered, we are doing this. At that time I said her, now everything is under control here. When once lockdown is lifted and from everywhere people started to coming to this small state, then I fear that situation will become dangerous. But we are not frightened because we have plan A, plan B and plan C. Plan A for the mild situation, and plan B for the difficult situation, and plan C for the severe situation. We are making COVID first line treatment centers, second line treatment centers, and even in the panchayat we are making domiciliary care centers for COVID care. And we are always working, never sitting there and watching. And that is why Laura Spinney wrote, because of this low mortality rate, low spread, she wrote like that in Kerala. There was very little thing like this, and coronavirus layer, and I never expect such a heading, and some opposition ridiculed on that, and it became a discussion again. But she wrote the actual things what happened in Kerala at that time.
Yes. You are a hard taskmaster, I am told, that you've been attending the the daily meetings and briefings of your department, and also with the departmental colleagues with other departments, and despite being sick also you've been on the job, and that leadership has borne fruit and the people of Kerala have benefited. But when the lockdown came, you were not only left with your people who are of Kerala, but there was a huge migrant population.
Yes.
From Bengal also we had a huge migrant population in Kerala. That was a challenge. How did you all address that challenge?
Yes, that was a real challenge, But in Kerala, we treat them, the migrant workers, as our guests before this contagion itself. We always ensure that whether the managers or the owners who brought them for work, for some private work, etc., or in government sector, whether they are getting proper food and shelter, we always were examining that. There are so many problems where they are staying in bulk in some cottages, and because of this toilet and like that, some contamination in water, etc. For that we are always examining the health condition also. Our health team, especially our health team, were the habit of watching them occasionally, whether they have any contagious disease or anything like this, malaria or like that thing, not only this COVID or other. And that continuous work also helped us. When COVID occurred and the lockdown declared, they were stuck in their camps there. All the work stopped and they were there. And who will provide food for them? That was the great question. Our Chief Minister said no one should starve there. We cannot allow them to starve there. Some people started to move to their own towns, hometowns, but they were afraid that in their hometowns the virus spread is too high than in Kerala. They expressed their feelings, and we said no need to return. You stay here. We will supply foods for you, food, medicine, anything, and we will examine you. We will trace you, and if you got the virus, we will admit you in the hospital and treatment. At that time, we were giving free treatment to all, not only for the poor, not only for Keralites, anywhere and everywhere. If a person infected by COVID, we are giving free treatment. Not only in government hospitals, if they were admitted in private hospitals, we are giving that fee there. Our government is giving the fee there. Such a condition, no need to go back to your states. Please stay there. We will provide, and they provide the chapati, rice, everything. If they want cooked food, we were ready to provide that. If they want these materials, the atta or other things, onion and everything, we were supplying that thing, and we were examining the quota and the food, if it is sufficient, everything in CM's meeting, Chief Minister's meeting. The public distribution department is responsible to answer how what is the need of these guest workers and how you are providing these foods, etc. CM directly questioned that things at that time, enquired that thing, and that way it becomes sufficient and comfortable there, And after the lockdown, when the lockdown lifted, again the people started coming. Not only the guest workers, but Keralites from other countries. They returned. They feel that Kerala is safe and we have to go there. That occurred, but a little bit the cluster occurred. At that time, we prepared a cluster management strategy, how to close the cluster and to prevent the virus from coming outside. And that activity also helped us very much. But a difficult work, but we managed by the preparation and the collective activity. I always said that the real heroes are behind the curtains. The doctors who were in PP, the nurses who were in personal protection equipments. One cannot stay in a personal protection equipments more than 1 hour, but they were staying inside 4 or 6 hours inside the burning heat and the sweat. The people cannot wipe out the sweat from their eyes, and they have to suffer very much. But they worked hard each and every evening. We have the meeting and they were saying, "Madam, don't worry, we are working for you and we are working for the government." And they are soothing me. I want to soothe them actually, but they were very brave young ladies and gentlemen. I cannot forget them, how they worked hard at that time. And they are the field workers, the accredited health, social activists, and they were also. I want to share all credits to them. Every time I am saying like that. It is the fact, And they worked hard. But the coordination that me and my health secretary and the officials from higher level, we coordinate everything from the state center. Not only staying here, but we were going to districts, Me and my health director and health secretary, we were going to each and every district. Even in health director's office, my director Sarita said, "Madam, we have to give some leisure time for this, happy moments for these poor nurses and doctors." I asked her how it is possible, Sarita. She said, we should have to invite celebrities in our control room, not directly online. They will come and they will speak to them. They will sing for them. And I decided to invite these film actors like Mammootty, Mohanlal, and youngsters also, and also the great singers like Chitra, our playback singer. Man, they sing song for these nurses and doctors who were working hard, and within that half an hour they get energized and they get charged again. And every kind of activities, we didn't forget them, abandon them also. Their safety is the most important thing, and that way we contain this thing. That is why they called us. And because of the NCD control that UN invited for the Public Servants Day to speak, I think there were only 6 or 7 speakers in that occasion, and they invite me also to controlling the NCDs. And we have a special program called Amridam Arogyam, and through that we were screening all the NCD patients, all the population based screening, and giving the NCD medicines to the doorstep and asking them to take it, compelling them to take the medicine, and also the exercise, other activities also we prompted. And we have yoga centers in our primary health centers. We started to have some yoga centers in family health center, etc. Examining that, they appreciated us and invited me to speak in that occasion. What is the system in Kerala? How you are? We have little money, Our state is not economically fit, or we were backward in that case. But the source mobilization from the society itself, we mobilized the sources. For building these corona hospitals, we asked the businessmen and also the international businessmen like M.A. Yusuf Ali. He helped us very much to building some corona centers in some places, to get some beds and ICU units, etc. Dr. Shamshir Weil of EPS Healthcare, Dr. Asad Moopan. There are so many eminent personalities and businessmen outside, Malayalis. and they helped during that time. Even the people also donate some money to the disaster management funds, and we were utilizing that monies also. So collectively we faced that dangerous situation. We didn't get more money from nowhere, you know, and money is not a problem actually. The planning and the policy and the implementation, that is the thing. And if we have so much money in our hand, in America they have bulk of money there, no scarcity for the money, but how the people died without getting oxygen in the first phase, that is the lack of planning, you know. And we planned well and we succeed.
Thank you. It was wonderful talking to you, K K Shailaja, former Minister of Health, Government of Kerala, and we've had from her a broad glimpse of what Kerala had planned for while facing the challenge of COVID, and her own personal experience of leading an entire team of dedicated workers, healthcare workers, who have diligently worked with an open heart to the people who belong to Kerala and the people who came from outside Kerala to spend their time in Kerala.